Is having a genetic condition traumatic? What role does the nervous system regulation play in a hereditary condition? Welcome to this episode of the Biology of Trauma podcast. I'm your host, Dr. Amy. Lizzie Dunn, diagnosed at age 13 with a genetic endocrine disorder, was told would require a lifetime of surgery and surveillance. She came to my nervous system work skeptical about how trauma could affect a genetic disease. So Lizzie asked the questions that many people with chronic genetic conditions are thinking. And in this episode, I answer how your nervous system still acts as the master conductor of your biology, how your nervous system states determines how severe your symptoms are, how living in your head is a survival mechanism for many with a genetic condition that perpetuates a trauma pattern of disconnection, how genetic conditions can make us more vulnerable to trauma responses, and how you don't need years of intensive work to experience relief of symptoms. You actually need small interventions in 3 different areas. Let's dive in.
Dr. Amy, from your experience working with patients and also the work you've done more latterly on your trauma courses and the book, what is it that you've learned about the way that trauma could affect a physical disease like MEN1 and dysregulation of the nervous system manifests as physical symptoms of disease inside the body?
For me as a physician, this was even shocking when I learned the depth to which it goes, Lizzie. And I had learned it on a superficial level. I had learned it on a research level. I had learned it from the studies that had been done. But to really see the impact and the influence that the nervous system has on everything, like you say, it will affect everything. And so I see the nervous system as being the primary location where trauma gets stored from our past experiences that weren't resolved. And our nervous system is in charge of our survival. It's in charge of our everyday moments. It's in charge of guiding our physiology, our inner biology to match the current situation that we're in. And I'll just give you a brief example of that. If you walk outside and whether it's hot or whether it's cold, guess who's responsible for changing your physiology in order to meet that temperature change? It's your nervous system. And so if it's hot outside, you're going to start sweating. That's your nervous system having turned on your sweat glands as a result of noticing our environment has changed and we need to respond to that. The nervous system is all about how do we respond to our environment, whether outer environment, inner environment, in a very dynamic way in order to help us survive. And thus, if the nervous system is what's really directing our inner physiology and our inner biology, it will affect everything. So even if we have a truly genetic disease, the nervous system is still going to be influencing the degree of symptoms that we have from that.
With a genetic diagnosis, which we're told MEN1 is, it feels as though it's very much a set thing. It's an endocrine disease. It's caused by a mutation. It affects these specific glands in the body. How on earth is the nervous system interacting? Why on earth is the nervous system having anything to do with the endocrine system?
And the way that I see the body, right, you take it all together because you can't actually separate it. And when the nervous system is deciding how to respond to a situation, whether that's an emotional situation, whether that's a physical situation, like walking outside with the temperature change, as the nervous system is deciding, what do I need to do to adapt in order to best survive in this moment? It's looking at what are my vulnerabilities? What are my vulnerabilities and what are my capacities? And when it sees vulnerabilities, that's where it's saying, oh, we may need to do a more aggressive adaptation or a less aggressive adaptation because I've got to protect this vulnerability. If we have a large capacity, and by a large capacity, it can be an emotional capacity, like maybe we feel We have support. We've got a community. We have people who get us. We have people where we can be our true authentic selves. That's a capacity builder. Maybe we have a great diet. We have a great lifestyle. So our natural rhythms are aligned with our body, from our melatonin to our cortisol, or maybe the environment in which we live is relatively toxin free. And so it's looking at all of these factors to know, how do I best help you survive right here, right now? And so when we have any variation in our biology, whether that variation is a genetic component or whether that variation is an acquired component, like a toxin burden or a nutrient deficiency, either way, it's still the same for the nervous system. It sees it as a vulnerability, and that means that we are not as strong as our mind would like to make us out to be. And when a challenge, a problem, or a danger presents itself, our nervous system is going to say, I'm not sure we have the capacity for this given our vulnerabilities. And given that, I am going to move into overwhelm or that trauma biology faster than if I didn't have these vulnerabilities. And it's that trauma biology that really creates more and more dysregulation. And dysregulation of the nervous system causes dysregulation of the hormone system, causes dysregulation of our cardiovascular system, causes dysregulation of our digestive system. The nervous system is what drives all the other systems because it's what changes them, allows them to adapt to our environment. And so the nervous system, when it becomes dysregulated in its responses, it's going to cause dysregulation of all the other symptoms and systems. Our bodies are actually quite incredible. And the way that they are designed is with so much ability to do well, to function well, even with some genetic vulnerabilities. And so looking at the power of that nervous system and realizing that the most beneficial thing that I could do for myself and my body is to help my nervous system be in its best and healthiest state. And then that, no matter what genetic condition I have, will allow me to be in the best health with that genetic condition.
And what is the best and healthiest state for a nervous system? What does that look like? What does it feel like? How would I experience it in myself, and what might I see it like in other people?
What a great question. It's like, where's the goal here? Where is our true north? Where are we even heading? Because a lot of people honestly haven't experienced that. They don't know what that means. They don't know what that feels like. And honestly, Lizzie, you've been through the courses. You can see how most people have never even truly felt safe in their body. And many of them have thoughts that their body is somehow working against them or is betraying them. And it does feel like that. And it does seem like that until you understand that it's actually slowing us down because it's protecting us from doing too much that would burn us out or kill us. And so as we look at what a nervous system, a healthy nervous system look like? Again, we're looking at the responses. The nervous system is all about being able to respond. An unhealthy nervous system is going to respond in ways that are either overreacting or underreacting. And it doesn't matter what it is, whether it's our blood sugar levels after we eat a meal and our sugar levels spike really high, that's overreacting, or we are in a relationship and something happens and we just are like, I just don't have the energy to talk about it, to address it, to look at it. I'm going to just avoid it. There's the underreacting. We can also see that with startle responses. Some people hyper startle, others don't do anything at all. And so that is evidence of the nervous system. So now we apply that to, then what would a healthy nervous system look like? And one of the analogies that has helped me over the years is to look at it as if it's riding the waves of life. Riding the waves of life. And I will tell you that previously I felt that my nervous system was just getting drowned by the waves of life. It wasn't riding waves of life. A wave would come and I would get drowned. And in fact, I would probably get slammed into the bottom of the ocean and then drug up on the shore and just feel beat up by life rather than feeling like anything, like I was actually riding the wave. So let's talk about riding the wave. What would that look like? What would that feel like? We've got imagery. Thankfully, we can turn on our TV and watch people who ride waves. So we know what it looks like, and it looks beautiful. But one of the important aspects of that, Lizzie, is this dynamic response. They're very alert, but they're not scared. They're very engaged, but they're not afraid. They're very alive. And so when you look at how they are even positioned on their surfboard, that they are in this state of readiness. And that's what a healthy nervous system looks like. It's not that it's waiting for the next shoe to drop and you're living in fear and hypervigilance. That's not readiness. But you're on your board, you're enjoying the view, you're watching the dolphins, you're feeling the water, you're loving being in nature and alive. And then the wave comes and it doesn't toss you off your board because you're ready. And you actually get up on your board. And that's what it would look like if a challenge or a problem came our way. We would rise to the occasion. We would be able to rise to the occasion and ride that problem all the way through, overcome that problem, rather than have the problem feel like it's drowning us and beating us up.
I relate to so much of what you have just said, and I wanted to dive in a little bit on coping. My way of coping with any difficulty, whether it was my disease or anything that was going on in my life before my healing journey really began, the active part of the healing journey, my way of coping was to not feel, and my way to not feel was to not breathe. And when I came and I did your course and we did so many amazing somatic exercises, I realized that I had such a disconnection from my body and I would shut myself off from feeling. And why do we exist in our heads? What is it that sends us from the body up into the head? And why can't we get back down into the rest of our existence?
And this is, you have just spoken truth. You have just spoken the human experience for so many people, Lizzie. And this was me as well. But the crazy thing is, I didn't even realize that I was disconnected from my body. I didn't realize that I was not breathing very much because I didn't have anything to compare it to. It was just how I had always been. So when I realized how disconnected I was from my own body, it really did come as a surprise because I had thought that I was very connected with my body. So when we look at trauma and overwhelming experiences in our life, most of us are not resolving those experiences at that time, which means it gets stored in our nervous system. And when that gets stored, there are these survival mechanisms that continue to play out because our body is still sensing we're in that overwhelm. That danger might still be there. We haven't had that full reset to safety. As a result, there is this pattern that I will call dissociation. Dissociation is a strong word. I don't use that lightly. But I really want to emphasize the degree to which we are able to disconnect from our body and function in a busy, stressful, overwhelming world. And dissociation then is just a degree of disconnection, and people are separated by different degrees from their body. But when you have stored trauma, that is one of the patterns that will show up to some degree, this idea of disconnection from your body. Why would that actually be a survival mechanism? How does that actually help us survive? As we consider what is happening inside of us during a response to something overwhelming, it creates sensations that are awful. We feel shame, we feel powerless, we feel trapped, we feel so alone. Those are awful things to feel. Why would I want to feel those? And in fact, if I let myself feel that, I may not be able to function. I may not be able to actually do what I need to do to survive and get through this. And so we look at that dissociation as a way that our mind and our body has developed to actually help us survive what feels unsurvivable. And then as that trauma experience gets stored in our body, we start to develop more and more inner pain, inner sensations that aren't comfortable. And then it becomes this feedback loop, because why would I want to be in my body? My body is in pain, emotional pain, physical pain. I don't like my body. My body is working against me. At least that's the thought that I have. Why would I want to be in my body? And so then we reinforce our ability to live from our heads, and we analyze everything. We learn everything. We study everything. We sign up for more and more courses just to be able to learn and be in our heads in the attempt to understand ourselves, not realizing that understanding is not what's going to change ourselves. It is that experience of going into the body. And as you've seen how I lead people to do that process, it's a very gentle process that is needed, because we've been disconnected for so long that if we don't do it in baby steps, we get overwhelmed and we're like, I'm out of here. This is not working. This is making it worse. I feel worse. I'm out of here. And so that process of connecting our head back to our body is actually more difficult than people might realize, which is why I see a lot of people still prefer to do things that are mind or brain based, like maybe meditation or some of the cognitive behavioral therapies, because that's their comfort zone. That's where they feel safer. They feel safer talking about it, analyzing it, trying to understand it, or using meditation as a way to escape their body even more. Let me visualize and let me go outside of myself and outside of my body. And all of that can actually be under the guise of something healthy and good, because we've been told that meditation is great, but actually it's just another way that our trauma pattern is showing up in our attempts to just not feel and be in our body.
The reason I'm grinning is because every single thing you just mentioned there is an escape route that I have tried to take myself. You name it, I've done it. I've been there, I've tried everything. And it is so true in my experience that until the body becomes a part of the healing journey, it cannot happen from the mind. And actually, when the body's not involved, nothing is really going to make a difference. Nothing is sustainable. And that is annoying.
It is annoying. It is inconvenient. It is frustrating. It is all of that. And that's where I was too. And I think that's where a lot of people go, right? Like, I don't think that we're different from most people, because we're all just trying to figure out, how do we do life? And if this is what feels like I can do and feel safe, okay, then let me go all in, because I do want a better life. And that's the paradox, is that actually the better life is going through where you don't want to go. It is actually connecting with that body. Just the way in which we do it is so important too.
100%. And you mentioned such an important word there, which is a paradox. And it's something that I'm actually in a bit of a process with over the past couple of weeks. This idea that or I'll speak for myself, I tend to gravitate naturally towards what I find easy. And it's, oh, this is, it's manageable, it's controllable, it's manageable, and I have oversight. And then when there's something that feels like I have to open up and be vulnerable, for so much of my life, that wasn't even an option. Maybe with the closest members of my family, but even then, they used to say to me, oh, you're so emotionally held together, and I took it as a compliment. It was an ego boost. Honestly, people would say to me, you're so resilient and you're so strong, and that's what we're taught as strength, which is such an irony. And we're never going to heal like that, or I wasn't healing like that anyway. And it wasn't until I found your work that I so understood I had to let those sensitivities open up and to receive help, for someone to come in and see me for what I was going through. And I think that is not second nature. And I think that is why, personally, we're in a state where we are with health and healthcare right now, because there's such a lack of that understanding of the body, which is central in your work. I know, absolutely central.
It frustrates me to no end to see resilience of that kind praised, because that's not resilience. That's pushing through, that's surviving. So let's call it that. Let's call it, hey, you're surviving, you're pushing through. But that is that resilience, that kind of resilience is going to come at a cost. And it's the same thing that I see them say about children, Lizzie. Children are so resilient. Look at how they handled that, whatever situation it was. And I'm like, oh, if you only knew what was happening inside, you would see that they've just stored and stuffed it. It will come back. It will come back later. It will present as a disease 10, 20, 30 years later. That's what you're praising for their resilience. And it's actually reinforcing their survival mechanisms of further numbing, avoiding, distracting, but holding on to those emotional wounds in order to try to hold it all together.
It makes me reflect a lot upon what our grandparents and great grandparents' generations must have gone through. Because, okay, it's not easy for us, but we live in a world where you and I are allowed to have a podcast conversation and put it out to the world about this. We're allowed to be vulnerable. We're allowed to share in our experience. But as far as I'm aware, my grandparents certainly were not doing that. And they experienced some atrocities. And it made me want to ask you, can trauma be passed down generations? Can we inherit trauma?
We see this and we have the studies to prove it. And it's fascinating, Lizzie, to see that it's in all the layers. So I talk about trauma impacting us on the layer of the mind, our thoughts, our actions, behaviors, beliefs about ourselves, trauma impacting us on our body level, tissue level, muscle memory level. When people take the biology of stress module with me, for example, they're always shocked to learn about that learned helplessness. And even the highest functioning practitioners in my training program, and they're like, shoot, I've got this learned helplessness pattern. And I'm like, because it becomes a muscle memory. But trauma also impacts us on the biology level. And when we look at generational trauma, we see it being passed down in all of the 3 levels as well. So when we look at the thoughts, the thought that you have to work hard, get a good education, because that's your best salvation. That is one of the most common thoughts and beliefs that are passed down in generations because of what our grandparents went through. Or maybe if there's been other generational trauma, the Holocaust, for example, there can still be those beliefs of I can't relax. I'm actually never safe. Even if I think that I'm safe, something might happen. I am a target. Those are all things that can be passed down in our thoughts and our beliefs. But then we look at the body level. And I've heard so many experiences of people who felt that that they were having an experience, a muscle memory, a tissue memory of something that they found out that one of their grandparents or even previous generations of parents had gone through. I remember one lady, and she had a story of she always felt like she was suffocating. And then she learned a story of one of her grandmothers, and it was like some kind of drowning experience. And she was able to move through that and detach that from her body. But that somatic implicit memory had actually been passed down so that she was the one who would have these episodes of feeling, I can't breathe, and wouldn't know. And then there's the biology level. And studies have shown that the DNA gets changed. And part of what I go over in my book is this idea of how oxidative stress is one of the central features of how trauma impacts our biology. And trauma becomes our epigenetic conditions. Epigenetic referring to the actual damage that it does to our DNA. It can affect us in our lifetime because epigenetic conditions are things like cancer, even autoimmunity. PTSD has now been shown to be an epigenetic trigger where our body just crosses a line. I call that the line of overwhelm, the critical line of overwhelm. Our body crosses that line where it says, I could clean up and handle this amount of oxidative stress, but I can't do this amount. And once it gets to an excess amount, it starts damaging our DNA and triggering these conditions. But this is also how generational trauma gets passed down, because they would have also had an excess of oxidative stress. That would have also impacted their DNA, not at the genetic level, at the epigenetic level, determining how our different genes get expressed. I think of it like a library. You walk into a library and which books can I actually check out and read? The librarian tells me which books I can check out and read. I can't check them all out. There are some that she's like, nope, can't take those. So that's the same thing with epigenetics. It changes which genes are able to be read and how they are expressed. Those are the changes that get passed down to us. Epigenetics do get passed down to us, and it gets passed down especially through the mother because of the mitochondrial DNA that gets passed on to the children. So it's the mother's mitochondrial DNA. It's not the father's mitochondrial DNA. It's the mother's mitochondrial DNA that gets passed on. So especially on that mother's side is where we see generational trauma being passed down and the impact affecting the later generations at a physical level, their physical health, symptoms, and conditions.
Most have some degree of awareness that a genetic mutation and the disease that comes with it is maybe not just, okay, you've got these symptoms and you have to live with it for the rest of your life. But when we ask these questions to our medical professionals, like, why is the gene mutation there? Where did it start? What am I potentially doing that I'm not aware of to be perpetuating it and passing it down? And the responses we are met with can vary. But the most common one is we don't know, or it's random, or we don't have evidence for it, nothing. There's no science to back up the hypotheses that are out there. Is that, in your experience of the work you've done, have you seen healing happen in instances of generational trauma where physical symptoms, whether or not it comes from a genetic disease specifically or anything else, but where symptoms have presented in someone, you can almost trace the line back through a family? Have those people been able to heal their trauma and therefore heal their disease?
For me, the biology of trauma is a message of hope because I was stuck in my own biology of trauma, both from my generational trauma, from my own, and then living decades disconnected from my body. And so further perpetuating this stress and overwhelm loop. And the biology of trauma, though, gives us repair tools, and it shows us and guides us into, and here's what you can do about it. Yes, we do have tools for oxidative stress. We do have tools for reducing that burden of oxidative stress. That is not going to be the only thing you need to do, though. And you're going to need to look at, right? You need to look at the mind level. You're going to need to look at the body level. You're going to need to look at the other biology factors and all this support, bringing in support. How can we support your body, your mind, your biology so that your body can do the repair? And this is one of the most important principles that gives us hope, is that the body, when it has what it needs, it can heal, it can repair. One of the, I think, most clear examples of that is when someone has a surgery. Have you had a surgery, Lizzie?
Yes, I have. Yeah.
Yes. Did your skin heal over the incision?
Yes.
Yeah, mine did too. Isn't that fascinating? Did you have to go to therapy and talk about it? Did you have to do the meditation visualizations for bringing your skin together, or did the body just heal itself from that incision?
Yeah, it just healed itself and knew what it was doing.
Isn't that cool? Mine too. I've had 2 surgeries and same thing. It healed over that incision. So this is, for me, I took that very clear example from when I was in general surgery residency, and I'm seeing these bodies heal themselves and repair once the block had been removed. And that was my job as the surgeon, is to remove the block. Oh, you have an appendicitis. Clearly that's going to remain a problem. Let me take out the block, and then your body can do the repair and the healing. So I'm just taking those same principles and now applying it over to trauma, the impact of trauma, knowing that the body has an innate capacity to heal. It has all of these strategies that are built in. We don't have to teach it to heal an incision. It just does it. So it has all of these strategies already built in. I just need to remove the blocks. And so that's what we do even with the generational trauma. If it hasn't been healed, something's blocking that. What's blocking it? Let me remove that block, and then the body can do its reorganization, its rewiring, and reset back to safety.
How often is that block something physical, like an appendicitis, and how often is it something unphysical, so intangible, perhaps emotional or mental?
I'm going to tell you, what a great question. I'm going to tell you that it depends on how long the trauma has been stored. And this is one of the key differences between responding to a stress in the moment and responding to a stress that became a trauma that became stored and now it's 20, 30, 40, 50 years later. If we can respond in the moment, even to something that becomes a trauma, we can complete that cycle, that response, and it doesn't create those lasting impacts on our biology, on our body, on our mind. And so in the moment, the blocks are more going to be something emotional and something mental because the biology just hasn't had the time to catch up. But you take that and you don't resolve that, and you now compound that over time. Now you've also got biology. And so now the biology, whether it be inflammation, whether it be nutrient deficiencies, a toxin burden, because stored trauma just attracts toxins and holds on to them, or maybe it's any other aspect of the biology of trauma that I talk about, those become the block. And since they're present all the time, then that becomes the constant background block. Now, our beliefs are also part of that. And I would say that when times are good, you may not recognize that you have self-limiting beliefs or beliefs about the world that are no longer helpful. A problem is presented or a challenge, and you notice yourself back in those thoughts. The world is against me. No one likes me. I'm all alone. I have to do this all. I can't trust anyone. And you'll notice those thoughts come back. And then that's when you know, I've also got some mental blocks that I will need to work on. But that's, for me, the beauty of being able to see how they all play together. Because if someone tries to come in and they just try to do the biology work, maybe they're just doing all of the gut stuff, the gut repair, the oxidative repair, but they're missing the somatic work. They're missing the movement. They're missing the mind and actually shifting those beliefs through the parts work. They're not going to get the degree of healing that they need. But at the same time, if someone's doing all of the parts work, they've gone so deep into internal family systems, maybe they've even gotten trained in somatic work because that's how deep they've gone in, but they've neglected the biology. That biology remains the block. So there are blocks at all three levels where trauma has impacted us, and that's where we need to go. And I love to be able to approach it in an integrative way so that if I'm working on someone, for example, if I'm working on their insecure, I'm not going to just do one piece at a time. I know that if I can come in and we're focused on attachment and I can work on the biology piece of attachment and the somatic piece of attachment and the parts work with attachment, we're able to create shit that feel sometimes like moving mountains because we simply brought in all the three pieces at the same time. It's when you only are trying to address the attachment from one angle that you're like, why is this so hard? I feel like I'm beating my head against the wall. You kind of are, because there's these other blocks that you're not addressing at all. And bringing them together, that integration of these three layers allows us to experience greater shifts than what we've thought possible, because what we've experienced is really just trying to come at it with one rather than all three. One of my favorite ways to express this is saying it doesn't take much. A little bit of the biology work, say we're still talking about attachment, a little bit of the biology work, a little bit of the somatic work, and a little bit of the parts work. You actually don't have to do that much of each to start seeing shifts, But we do need to bring in all three, because when you have all three, they're like small hinges. And when you've got small hinges and you've got three of these small, you just did baby steps, small hinges move big doors in our life.
A shift could happen really quite instantly, but it needs those three integral pieces in order to be making a step forward. Is that right?
That's what I've seen. And what I have also seen is people who do one thing and they feel that they've had a shift. But oftentimes that shift is either just intellectual or it's only temporary, because when they go back home, when they go back to their regular life, when they go back to their usual relationships and the same kind of conflicts start happening, they're noticing they're back in their same patterns because these other areas, these other layers are still going to be the block. And so it really does require us to be removing the blocks on all the layers for us to experience shifts that will stick. With all of the information and the research that we have, this is not what you're going to hear from your practitioner. This is not what you're going to hear from your therapist. They're not bringing all the pieces in yet that are essential, and leaves the person to have to figure out their own path. And that's why I wrote my book. I really wanted to be able to give people that clear path forward. Not that it's an easy path, because we've already talked about just how hard it can seem to connect my mind to my body, but it doesn't need to be confusing. It can be a clear path. And then we just work through, how do I walk myself through this? How do I pace this? How do I create that safe enough to be able to walk down this path towards my best health and my best self?
You mentioned earlier insecure attachment. I noticed a pattern in a lot of my intimate relationships where I felt very anxiously attached to my partner, in that I needed to have that person around, or to have that person act in a certain way for me to feel safe and feel seen and secure. And I'd heard all the kind of classic, oh, that's an insecure attachment style and anxious attach, and I need to do something about attachment. It's the same memory that comes back to me, the same need that wasn't met, and the same cry for attention, which was manifesting in my adult relationships that had never been met when I was younger. Why is it that going in and spending time with my 5-year-old self is going to be helping me in my adult relationships and in all of my relationships 20 years later?
Isn't that crazy that our 5-year-old self can still be such a block? And that's exactly what happens. And I remember so many times feeling like this internal resistance to doing something, or to when I was in the middle of a situation, and realizing that there was this illogical but very real fear, panic that was coming up, that was so much more powerful than my adult, logical, rational self. And as a person who prided herself in being rational, logical, and not into that emotional stuff, this was talking about a paradox. This was quite interesting. And to discover that there are these younger parts of ourselves. And one way, I love Dr. Janina Fisher's language around this, is that these parts become fragmented, meaning in that moment, that younger self, when I was that age, I experienced something that was overwhelming. I didn't understand it. I couldn't process it. It started that disconnection from my body, because it created these sensations of, I'm powerless, I'm trapped, I'm all alone, and I just have to go along with something that I don't like, and I can't make it stop. And not knowing at that time, or not having people in my life at that time to help me resolve that internal experience, it just got stored. But when it gets stored, it's like that self gets fragmented and stuck there. I remember working with another gal, and we were working with her younger part in that biology of attachment course. She realized something powerful, that her little girl was still waiting for her mommy to just acknowledge her. And her little girl was still waiting, and she was in her 30s and had developed chronic fatigue. No surprise. So this idea that these younger parts need repair, that is part of the repair, and that those younger selves also are contributing to the inner tension, the inner stress, the inner overwhelm, that creates more problems in our biology. So if we really want to shift our physical health, then we will need to also go back and look to see what parts of myself did get fragmented, that are still waiting for something. And I need to be the one to go back and rescue them and give them what they need, so that now they can come along with me and be now in the present moment in our adult life.
I love that. And I found it personally so empowering to think that the only person I really needed in my life was myself. Doesn't mean I don't want other people here. Of course I do. I love people. I'm a real extrovert, but it is very exhausting. You talked about chronic fatigue syndrome. I honestly, I experience more exhaustion from emotional and mental upset and weariness over patterns and thoughts and emotional states that are happening inside my body, inside my head, than I do my disease. That's what the telltale sign for me was, that actually my disease is not my diagnosis. It is that trauma that's stuck and needs to process. And I am so grateful to have found your work. And I know so many people are, because as you said, sometimes we come at things with such a logical, heady angle, but until we bring the body into it, it's just not going to be sustainable. And that's something that you do so well. And I know you've experienced that in your own journey, and bringing all these separate components together is so remarkable and very much needed. I obviously talk about your courses, and I've done one of them. Gentle but powerful introduction into trauma healing, into somatic work, into parts work, in a way that also creates space for enjoying the science as well, enjoying the graphs, enjoying the data, the stats, all of that, because that has a place and that's important. And I know, Dr. Amy, you recently published a book. Please tell us, what is that book about?
It is on how the body holds fear, pain, and overwhelm from our past, and how to heal it. So it's broken into 3 sections. The first section is on how does the body experience a trauma? What is that actual process? What is that actual definition then? How would I know if something had been stressful or if that was a trauma for my body? How does the body experience trauma? That's the first section. Then in the second section, I say, all right, so if we experience a trauma, why does the body hold on to it? Why doesn't it just let it go? Why can't we just move on like we all want to do? Why does it actually hold on to those emotional pains, wounds, the fear, and the overwhelm of it? How does that actually happen? And then in the third section, and here's what to do about it. Now that you know that it is holding on, and here is how it has been holding on in the different ways, the different impact that it's had. Here is your clear path forward. Here are these 3 layers that we need to integrate, and in this order, in order to align with the body's natural healing strategies, so that we can experience these shifts that we've been talking about and truly be our best health and be our best selves, no matter what condition or genetic vulnerabilities we may have.
It sounds like the most phenomenal piece. And I have this book and I've been so excited to read it, because when I have worked with someone or I've had the chance to speak to someone in person, to then go and read something that they've written and to see and experience what it is that brings their ability to practice and share that gift together is so rewarding. So I'm really grateful for, Dr. Amy, everything that you have shared today, your time, generosity of time and wisdom.
As we wrap up, I want to highlight what might be a shared experience for you or those you work with as a professional. Feeling more exhausted from the emotional ups and downs of managing a condition rather than from the actual condition. When we have a biology of trauma, approaches like cutting out gluten or doing therapy can provide temporary relief, but don't address all 3 levels that we discussed. I do love hearing from you, the listeners of this podcast, readers of my book, and those who enroll in my courses. So please share. I get inspired by what you've lived through, what you're doing now, and what your next level of healing looks like. You can tag me on social media. LinkedIn and Instagram are a great place to connect with me. If you enjoyed this episode, I strongly encourage you to look at episode 118, which was on how practitioners can navigate their own chronic illness and healing journey, and episode 128 on how attachment trauma drives anxiety, autoimmunity, and chronic illness. I'm here to save you time and money by bringing you practical information that will help you accelerate the healing journey for yourself and those you help. I'm your host, Dr. Amy. Until next episode, lots of love.